So here's an economic impact. It's a simulation model that Ray produced. It's just used to show that or assess the impact of trick on individual cattle operations. Made the following predictions: 5 to 35% reduction in return per cow. Particularly, small profit margins on most operations. That's a big deal. The variability of this disease, though, and that's a real head scratcher, has been attributed to the prevalence varying significantly between herds, and then again, difficult to actually put a number on that, even though it's significant. 91 Spear and White, they made a study and tried to look at it across the entire industry, but it's really difficult. They predicted in $91 in market that 650 million was extrapolated every year from the beef industry. But difficult to do that. We do see, again, that's a pretty significant reduction in this model that Ray produced at the University of Florida in 1989. This is what we should expect, and this should be consistent with candy and trick. Okay, so here's our normal candy distribution. From an eye, I'm talking about it all before med school. They come back home. This is what it normally looks like. Overall, we're going to see a significant decrease in pregnancy rates. Usually, it's not like it's extreme as my example when the trick was acutely introduced to that herd. Usually, it smolders in the 70 to 77% pregnancy rates. It may not be a big deal or seemingly a big deal to some producers. So, like, who cares? So they don't find it because we don't look for it. But overall, if you put these calves, you sleep on them, really, there's some value in putting them in different trimesters or aging them, taking a minute to age them because it can alert you to certain inefficiency issues in the reproductive part of the program. So most of these calves that are going to be there, they're going to be at the last part of the season, depending on how long it is. Overall, we're going to see more open cows, the smaller the breeding season. Okay, because they're not going to have a time to recycle if they were exposed early in the breeding season and clear it at that point in time. But overall, most of your calves that are present are going to be lighter. Okay, and that's where we saw major economic losses. Lighter calves, string out calving seasons. They still sell them by the pound every day across these United States. Here's some differentials. Okay, Campylobacter being the top one there. Herpes virus being another one. I'm not going to go into. There's a lot of conversation about ureaplasm. I was just talking with a veterinarian about that at ABP this year. Even the normal inhabitant we call reproductive tract, so it's difficult to find fault in that particular organism, and also mycoplasma, this form of mycoplasma, because you can find that in normal producing cows in the normal flora in the vagina. It's been pointed out that nothing definitive there. We've chafed it a couple of times, but nothing. And then subfertile bulls. Subfertile bulls look just like this sometimes. Okay, so you got to be careful. Make sure that he's producing good quality semen. It could be one of your differentials. Treatments. Hey, I'm going to get on the Texas A&M bandwagon here just a minute because they really been pushing this. I'm with them. Okay, so no approved FDA treatments. All right, we should understand that. Why I want us to understand that is, Dr. Laura, she's probably getting ready for the talk, but she's in meetings that I'm not in lots of times. And what she tells me is, once it goes on that list, it doesn't come off that list, meaning no extra label use of the imidazole. Okay, all these imidazole-derived derivatives, diclofenac, thiazole, tinidazole is a second generation. It's being used on the human side. Now, I studied the human side when I was doing my master's work extensively to try to translate that to the accessory sex glands of the bull. And what I found was that trichomoniasis is the most common non-viral STD worldwide, okay? Particularly in third world countries. But guess what the treatment is? Metronidazole, tinidazole. So I questioned, I said, hey, how come we can't use this in species if we apply a perfect withdrawal time? Here's the work that was done in the late 70s, early 80s. Rats, increased risk of neoplasia. The only fallacy I found in that work was, yes, they were more of an instance of neoplasia, but also these rats were healthier compared to control. They lived longer, they ate more, they got fat. We know that long duration of life and obesity increase our risk of neoplasia. I would argue, just like Love and that group did in 2017, they reported that with 2 doses in these positive bulls at 60 mg per kg, 24 hours apart, they cleared this organism. They followed him out, they cleared this organism. Now, was the injectable form of metronidazole? They cleared it. So, how great would that be? If they wanted all of us to say, hey, FDA, beating on the door, hey, we should be able to use the integral derivatives and solve this problem. My colleagues in down in South America, they're like, just keep metronidazole. We can't do it. But what I'm operating under is we got to find something because the FDA is a slow-moving, large organization, and they're unlikely to take this off. All because the uber mammal, the rat, which we could also argue is that the best testing specimen here for neoplasia after they got fat is repeated doses. Okay, and they give it to us. So I question that. But lots of topicals have been used. The problem with the topicals have been this. On the bull, practically applying that, and also there's some secondary damage we don't want to cause to the liver device. Okay? This can cause some burning effects, Lugol's, okay? Strong iodine. I don't know if we really want to use that in that area. So all of these have fallen on disfavor. So we don't have anything out there. Also discouraging. Let's keep going. What about sample collection? Well, in these United States, not in Europe, we would typically are going to get a dry aspirate, a scraping of that. In Europe, if you look at what they do a douche of the prepeats, okay, with some steroid. Both are equal in sensitivity. So it's just kind of how we were trained here. There's lots of raspers out there. I've got some examples here. We'll get some work on this recently. I'll show you that in just a minute. But we typically recommend 2 weeks of sexual rest before we start testing these predators. 1 week apart. Why? To allow multiplication of the organism. Gives us a better chance of diagnosing. Now, Andre, who I work with a lot, he's a great researcher. He didn't publish his work. I'm about to show it to you. And might say, not so fast. Right? So leave one, so not so fast. I'm using the bull rats. Not so fast. He found that these bulls were not consistently positive until 19 days after one interaction. So I really want to be good at diagnosing it. Maybe I should go away what I was recommending. It's called Australian work. Maybe I should wait 3 weeks, particularly on those bulls that we don't know if they're high shedders, if they're low shedders. What I will tell you from this research is that if a bull is a high shedder, he's always going to be a high shedder consistent. If he's a low shedder, it's the problem. He's always going to be a low shedder. Interesting. And that's been dictated in multiple studies, but also recently by some conversation I had with Dr. Hereford. This drug for the female is definitely, if you find her aborting, the fetus, we find it routinely in the abdomen. If you find it, great specimen, always submit that to your diagnostic lab, get your producers to do that. The entire specimen and the cell parts, fluids, great thing to do. Here's that work. When I'm preparing to test bulls for trick, you can use any of the raspers out there. I get some chlorhexidine. I make sure I identify this bull with the approved form of identification. Okay, the A40 tag is necessary. We want us to use these electronic tags, and we should. I've got some saline here. If we are using the newest qPCR that's available in some laboratories, it can be run on 1.5 mils of PBS or just sterile saline. Right? In a red top tube or one of these conical tubes, you can ship that. Here's the new TF2 for Biomed. I don't have any of the pouches out there on the screen, but I have some paper towels. I have something to apply negative pressure to whatever device I'm using to get my sample. And then I have this big 50 mil caliper tip if it's nasty. You ever got a bull's penis exposed? What's this jumping in the blue around? That is so dirty in here. And that's definitely not what we want, particularly if you're using the enrichment media from BioMed, because you can get some bacterial overgrowth, and it significantly affects the sensitivity, specificity of that, whatever test that you use. So we don't want that and get that bacterial overgrowth, which is a big problem, again, with the enrichment media, if it's dirty. I want to make sure this bull is clean, that he is restrained, okay? I want to make sure he doesn't have a lot of lateral movement or cranial caudal movement in this shoot. So I want to make sure he's captured. And then use gloves every time. New gloves every time so you don't get cross-contamination. These are single use. Single use. Make sure he's been out there in that swamp in Louisiana. We clean this prefuse after we cut it. And I put this chlorhexidine up here is because I want to disinfect that between bulls. We can get cross-contamination. So eliminate the organic debris. And then I want, because it's a microaerophilic organism, if I'm using the pouch, I usually like these needle boxes because I want to stand that pouch up so the organism has an opportunity to move away from any residual air that's in the pouch that actually rolls down. Another technique with the pouches is don't staple them. Okay, that's just not to staple them. We want to try to create the best environment. We have the best chance to diagnose that bull. This is my setup. Okay. Here's the video that I shot. There's lots of them out there. Jennifer just published one and the technical stuff in AVMA. Kansas has one, and there's several videos. I've cleaned this bull. I've got my hand up here. We've introduced this pipette, the fizzle stick into the pouch, and I'm moving that around on the fornix and the more proximal part of the penis because that's where Androck find the highest concentration of Trichomoniasis. And so I want to give myself the best chance to get the organ highest concentration at the fornix and 2 centimeters distal to the fornix on the penis is what they found in Nebraska and some of their work that they did in Arizona. You notice that I'm careful with the hand that had on the bull's ventrum. I'm moving this around on one side as I'm making those inward and out motions, and I'm trying not to cause any kind of trauma to the fornix. One thing that we found that veterinarians have been sued for is causing a retropercutial abscess by sticking the mare pipette through the fornix. Okay, it's a great place to cause an abscess, and we don't want that because he's pretty much done at that point. Here's that area I was talking about that I want to focus on inside the critter. Okay, transdermally, I'm trying to take that up there, and you can palpate it very easily as I'm going around and making those search motions. Anywhere from 20 to 30 search motions. I'm spinning this pipette as I'm doing it to get the most smegma on this pipette or in the mare, whatever you choose, okay, to use. I'm spinning it a little bit and then applying some negative pressure with that 12 cc syringe. Letting it off, a few more search motions, putting one more negative pressure on there, and then coming out, making sure I don't contaminate the end of this pipette before I inoculate whatever tube I'm inoculating, either the BioMed enrichment media, or if I'm using PBS, I'm shipping that to a lab that accepts that. Side of the chute, doesn't matter. There was some work by Dr. Parker earlier that was done in Australia. They indicated that you needed to be on your dominant side. So if you're right-handed, you was more of a chance of diagnosing if you on the right side of the chute. We questioned that. We did that work. It's been published in Bovine Practitioner. Get you a good sample, trauma, low amount of blood, if any at all, is the key here. Doesn't matter what side of the chute you're on. We did question that work, and it's been disproved. Here's that work from Androck, real quick. Culture and PCR running parallel. They did not, in this study, they had one interaction with a positive cat. And they let these bulls, they had 3 bulls that actually made intervention. They had a variety of bulls. Some of them were really, really old in the study. Androck did a great job. He changed jobs and never published this. He lets me tell people about this because I think this is fascinating. Jeff is a tremendous scientist. I think this is fascinating. One interaction with this cow. So they only called them positive when they got both a culture and a PCR positive on these bulls. So you see, we had one bull at day 1 was both PCR and culture positive. Interesting. Then it goes negative. Look out here. Not all 3 of them were not consistently positive till day 19. I want to be sure. If I catch them on the wrong day here, okay, these bulls were all low shedders when they looked at the number of trichomoniasis, but even so, out here day 19, they could consistently get them. And so for me, I had gone away from that 2-week period. I'm waiting for 3 weeks to be sure that I'm doing a good job. Those bulls are that the organism is replicating enough where I can find it with even the best tests that we have available. A lot of the work's been done right here in Mississippi State. Dr. Jumper and them, that crowd is doing tremendous work with the group at Texas A&M. So these tests are much more sensitive than they ever have been. The PCRs are much better. They can find one organism. But again, if I'm going to test them, I want to wait until they've been out of the cows about 3 weeks for my home practice based on Andre's work. Sampling devices. We hadn't done this work either. So me and Jennifer were like, hey, let's do this work. We had these positive bulls, and we did multiple studies with them. And we wanted to look at 3 most commonly used. Now, when I was in practice, we always used the mare pipette. Nothing wrong with this. But we evaluated the pain scores on these bulls. We evaluated the sensitivity and also the trauma scores after we slaughtered these bulls. Okay. So here's the Trichomoniasis made in Wisconsin. Here's the fizzle stick made by Lane, and then of course the mare insemination pipette that we've all used. You like certain things about all of them. I wish the fizzle stick was clear and aluminum like this mare pipette, so I could really see it. They said they had a problem with manufacturing. The engineers just couldn't make it work. But what we found, the take-home point, you don't have to read it. Trichomoniasis and insemination pipette were much more traumatic, even though I was doing this. So I felt like I wasn't as aggressive as some. Maybe my mentors would have been, because because of the crypt conspiracy, it was thought we have to get blood, almost like when you're trying to look for Demodex, you got to get a deep scrape in there to find the organism. Actually, the blood interferes with some of our molecular tests, and it shouldn't be something that we're shooting for. We just want a good cellular sample, and I don't want to actually cause any trauma here if I can avoid, or very little. Okay? Outcome was of that study, this outperformed simply because the low aversion scores that we had with this, the same sensitivity and the least trauma. If you're using the mare pipette, it's got a little bit of a hood to it. You'll see it as you enter. So you want to be very careful. I hit the 4 inch if I'm using any of these, and then I pull it back about a centimeter to 2 centimeters before I start making my searching motions to get a good sample. So I'm not butting up against that point and causing that problem. Okay? All 3 modalities, whatever you're using, you can get a good sample. That was what we found in that study. Still can get a good sample. Just be careful with the Trichomoniasis, with that hooded part, and also the mare pipette, because it can cause some trauma. Here's all the different mediums. I'm mentioning this because this is coming. Okay, that newest PCR that they have, that most states are trying to go toward, at least thinking about it, is run on sterile saline and also PBS. And the reason why they like that is because this is an RNA-based test, and also because we don't get as much bacterial overgrowth with this. There's better outcomes there compared to some of the enrichment media. Now, if you're using this, this is not advised to be used. The pouch is not advised to be used for the PCRs. The tube is better for that, and also if you're cooling, they suggest using the tube as opposed to this. You still can submit that, but it's a little easier for our lab personnel to work with this. You're going to pool the samples at the lab, or if you're using the molecular techniques, which a lot of people are. Sample transport is so important. What I want you to understand is there's been so much work done on this. Here goes the one of Andre Davidson. We've done some of it, but what you'll find is we want to avoid temperature extremes. Take care of that. It doesn't like anything. Trick is like a cat. It doesn't like anything. Okay? It doesn't like light. It doesn't like big swings in temperature, too hot, too cold. And so we want to keep it overnight at room temperature if we can. Okay, avoid these temperature extremes, avoid light. Try to create an environment where it can survive. At least, and if you're doing the molecular techniques, the DNA can be degraded, okay, under poor conditions. And so we want to take care of that. And here is also, we want to get it there quickly, okay? Get there overnight. Here's the culture again, 5 to 7 day turnaround. They're going to look at this every day. This is just an old slide, but we used to read in our own clinics, you know, if you're looking for it, but the lab needs to receive it within 48 hours. This is the most inexpensive test that we have available. They still use this for CSS. They're going to do a culture for 6 weeks on these bulls that are in isolation for a CSS program. False positive from fecal contamination, we get organic debris in there, the pinch of trichomoniasis. It can look like that. Again, you have to have a really sharp lab person to know the difference and those morphological characteristics of those trichomoniasis. False negative, we just didn't get the organism. Didn't recover it. Maybe it's in a pseudocyst form, okay? In a poor environment, the pH was poor, and they didn't see it. So that could be an issue there. A lot of people have gone away from this using the molecular techniques or running these in parallel to improve their sensitivity. Here's what it looks like. If you haven't seen Trick, this is what it looks like. The video we took. It's kind of herky-jerky rolling behavior, and you really got to stop it to really see the characteristic, morphological characteristics of it. The other membrane with causes those the anterior flagellum and that one posterior flagellum. Again, we see improved primers is better than ever. Our tests are better than they ever have been. If you look in 2006 from where we are now, 20 years, it has been a significant difference. In that study, with one test, they found no difference in sensitivity. It smolders in that 78 to 80% sensitivity in that old PCR that we had. Now, it was good, but it's much, much better. The primers are more sensitive and more specific than they ever have been. So if you're doing this, we get rapid results. It's much more expensive, but there's a significant improvement in the diagnostic capability of these new molecular tests. Here's one that I just want to put out there that was, all this was published in 2018. This is an RNA based detection, which is technically favorable for this organism because there's a higher abundance of target RNA copies when compared to DNA per parasite level. So we get a more opportunity to diagnose this on a lower parasite count, those bulls that are lower shedders. And so this is supported by some labs. You have to touch base with that lab to see, but again, much cheaper. Also, the red top tube or the one that's conical tube, you put some PBS in there, and it must be received by the lab within 120 hours. I'm going to say that's not good enough. I want to get it there in 24 hours. We do not recommend testing at the end of the week. Okay, we cut that off by Wednesday because I don't want it sitting on the lab at the dock. Okay, your sensitivity goes down and down. Time is against you. So time, temperature, handling, all that's really important, even with the best test that we have available. Okay. Here's the female stuff. I'm just going to go through real quick before lunch because I'm right on the. I got you against lunch. We did this study. This is some of the work that's been done. It's really been limited in the research, and so they've looked at it through an RT-qPCR, which is the latest PCR that's available out there. In this one study by Summerall, 5 of the 16 of those cows were positive. They said in the discussion they admitted a small sample size, but showed that T. fetus could be found in these cows through RT-qPCR in that cervical and the uterine fluid. Okay, and this was done also by direct examination in inoculated cows. It was not a natural challenge like what we did in our study. And both of these were in inoculated bulls, not bulls that came in from a natural infection. In this one study by Parsonson, 19 out of 20 of those cows were positive, which was interesting. So that's really what the extent of a lot of the work had been done in the literature. So not a lot compared to the bull. She's just not a great sample. So this was our objective. We did a vaginal douche with saline. We had obtained some cervical vaginal mucus from these heifers, and we applied a low volume lavage of about 60 milliliters. That had been validated by a previous study done at Washington State. And these naive heifers that we exposed to a bull, when we were going to diagnose this with qPCR, we drove this sample to the lab to try to avoid that variable. We were out in Texas, and we drove this to the Canyon lab, Texas A&M. So what are our hypotheses? We thought that the uterus would be our best sampling modality compared to the cervix or also the cranial vagina. And that positive samples would decrease over time, understanding that the cow is trying to mount an immune response and clear this organism. Here was the materials and methods that we did. So the bull, we tested this bull before he went in. We introduced this to these naive heifers, and they placed estrus detection patches to let us know that he had actually mounted those bulls. To ensure all these heifers were cycling, we palpated them before we were introduced them to this study. The bull was removed after 30 days, and then time point 1 is day 51, and then time point 3 is going to be day 72. Here's our samples. Okay, this is from the cranial vagina. See how cloudy it is. This is from the cervical vaginal mucus. And here is our low volume uterine lavage. We had some issues with return on some heifers in this study. As you might could see, these heifers were almost ready to be killed. They were so conditioned. But we did have a little bit of a technical issue, which we acknowledged in the discussion as a limitation. Here's the samples, and what I really want you to take out of this, here's the conclusion. We saw no difference in sampling location in these females, even though if you look at the data, only 14% of those samples were positive on the PCR, which was underwhelming, but not surprising if you look some at the previous literature. The female is just not a great testing specimen, even though when they've been exposed to a natural challenge. This bull was found actually in the north part of Louisiana. We found him to be positive, and we bought him. And he's one of our high shepherds that we used in this study to try to help with the results. We had 2 heifers that were continuously positive until the end. If you're going to do this, Dr. Tom, I would say based on our work, we need to do it within 51 days of exposure. Okay, the longer it goes, the less chance we have to diagnose it. And again, that chronic cow is a problem for us. Here's all the things we mentioned before. Avoid these temperature extremes. It really is depending on us. These tests are better than they ever have been. It's not the test. The labs do a great job. We've got to do a great job in the field and then getting it to them. There's been some pushback by some veterinarians that I've worked with in West Texas. So we got people rural American. I said, I get it, but it's according to FedEx, they go everywhere. And they'll come to your clinic. And so I think this is something that we just need to understand. If we really are focused on eliminating it and trying to do the best for our clients, get it to the doggone lab as soon as we can. I've even done it after church on Sundays because people couldn't do it any other time during the week. I just don't want it sitting on the lab dock, and so we don't do trick testing again on Thursdays and Fridays unless I can directly deliver it to the lab and they're going to start testing through one of the modalities. Usually I'm requesting a PCR. Okay, you can lose trick in 3 places, and these are the places. What are some control status strategies? Testing the bull. Okay, 3 negative tests, 1 week apart. With again, I'm recommending 3 weeks of sexual rest to allow for multiplication based on Andrak's work. This has been something that I have really worked on when I've had positive. We did that. We instituted that in that particular example that I mentioned at the start of this talk. That really made me think about trick more than anything else. Cull bulls, all the bulls. I've had clients that's done that. That is an alternative. That is expensive, right? And not something that everybody wants to do is pull the entire bull battery, but making sure those open females, those non-productive females, are moved on to colder climates, moved to a cell barn, the result of slaughter only, be a recommendation. If you have someone that is a really, really good manager, and they say, well, I'm just going to move them into a different breeding season. There's a bull that has to be tested, and he only stays with those cows. Okay, and good fences make good neighbors. Good fences also help on a particular operation as far as your control of this disease. That would have to be something you have a real stringent conversation with the owner, I would think, if you're going to do that. Take those non-productive females and either use natural service for that one particular bull in a single sire unit, or you use Tolai in that case, okay? And you can see if that type semen to do that. I put a vaccination question there because what TrichGuard's going to do is not going to prevent infection. It's not an immunotherapy. There's people on both sides of the house in the literature as far as its efficacy. Our data would not support use of it in every herd by any means. It has its place, but it does seem to reduce fetal loss. And those cows will recycle quicker when exposed to that if it can be administered according to label directions. So maybe it's a part of that control strategy that you implement across it's not cheap compared to other vaccines. As far as prevention, maintaining a young bull battery is very important, okay, to try to limit those bulls become chronically infected with urine and get urine. Of course, artificial insemination, great way to eliminate that, and that's what the dairy has done, and also those countries in Europe have eliminated it by almost total artificial insemination. I don't think the beef industry is going there by any means, but it is a means for doing that if you're working with a herd, and particularly some of those smaller herds that I mentioned in some of the non-dairy. Isolation protocols, non-virgins, they're coming in. That is a break for biosecurity. So I'm going to test them. I don't trust any bull is a virgin. Okay, so I recommend to my clients, it's not nationally known, it's not going to be every treatment certification workshop, but for my clients, I'm responsible for their well-being, their sustainability. I say, hey, the bull comes in, we're going to do a BSC on him. We're also going to test him against not only trick, but I'm going to think about things like plasmodium. We'll have time to talk about it today, but real negative effect on fertility if they're anaplasma positive. So open females, you got to be real careful about that. With non-virgin males, limit the breeding season so you know you have it, and again, you don't disseminate it throughout. And then again, they have these combination vaccines. The TrichGuard is monovalent. What they'll tell you is the duration of immunity is not very long, so you have to get it right up to close to the breeding season. But would I use it in endemic areas? Yes. I put it part of my preventative health program in endemic areas to try to help with that situation. Here's the label again for vaccination of healthy cattle. That's kind of a fun thing they do. We found it not to be efficacious in the bull. That work is being published as we speak. That was a dogma that I found in South Florida. Everybody thought, half of them thought that they could vaccinate their way out of it. We found that not to be true. And they also thought that vaccination of bulls would be a great control and preventative strategy, and that is simply not the case. Okay, I can say that definitively. But it's funny on the label how they word it for the vaccination of healthy cattle. Bulls are cattle. But we've seen no efficacy in the bull as of today. So there may be a better vaccine that's made. Here's prevention. Again, good fences make good neighbors. I try to encourage these larger operations, maybe affected by a tree falling on or something, bull. It's hard to stop a bull from a neighbor who's maybe doing everything right, and the neighbor will not. You got a cycle female on that fence line. It is too tempting to that knucklehead on the other side, even with good fences. And so, in some places, the management is there. You can move those cycling females maybe over away from the boundary fences to try not to encourage that bull from jumping. Of course, a bull knows no boundaries, love knows no boundaries, but that is a better way than tempting them with heifers that are cycling females that are cycling right on down. My surveillance program in endemic areas would be to test these bulls before the breeding season as they come out. Again, I'm waiting 3 weeks as they come out of the breeding season based on that work that we showed you a little earlier. I think it is tremendous what Mississippi's doing. I applaud Mississippi for what y'all have done, particularly since April 2020, and this is available to you. I'm just talking about the highlights of it. Dr. Houston, back to you. We got a great video that's available online. Here's some of the highlights that you need to know. USDA accredited veterinarians, type 2 veterinarians, are the ones that can do this type work in the state of Mississippi. And you must be registered with the Mississippi Board of Animal Health. I see them out there right there. And they're here to help you. There's an approved video. This will also serve this training. This me talking to you will serve as training as well, and you have to get that approved through the board if you're going to do in-person training. There's an application process, and then there's a test. I think we're going to have that if you want to do it. It's available.
What we're going to do is, for those of you who are in your guide, please sign this one. So this will be your in-person listening. So I do have a list. We'll start back here in the hospital. For those of you that are viewers and maybe not there's devices will be today's certification. For others, since it's recorded. That's what we use.
So call the board if you're going to watch this video and you need guidance on that. They'll have all that for you if you're listening on the video. But you must be accredited in the state of Mississippi as a USDA type 2 veterinarian to be able to do this. So you must have that first. This certification is good for 5 years, so you won't need to recertify for 5 years. But keep that paperwork with you so you can submit samples to a diagnostic lab. The regulations for interstate transport, interstate transport are available to you. The one I like up here, you can look on the state veterinarians websites in every state. It's a great resource for you. I have this on my phone because we're always moving. I think it's great. It gives you the most latest guidelines for every state if you're sending cattle there. What their guidelines for multiple diseases, but particularly for trich. And so this is produced by the United States Animal Health Association, so you can trust it. Okay, Global Vet Link also provides some good resources there if you're providing a CBI through Global Vet Link. It is a reportable disease in Mississippi, as we mentioned earlier. So the entry requirements for bulls, if they're greater than 18 months or known non-virgins, y'all know my stance on non-virgins, they must have a test. Okay, either 3 negative cultures or 1 PCR is required, with those cultures being 1 week apart. The virgin bulls must accompany a statement on the CVI that says there's been no known exposure to females. All right. Now we can talk about that afterwards, but the exceptions are bulls that are coming here for show, or bulls that are rodeo exhibition bulls that are going back to the resident state without being exposed to females while they're here in the state of Mississippi. And also, if they're destined for slaughter, okay, they don't have to have that. They must be statement where they're marked for slaughter, but they're destined for that and they can't be exposed to females. Testing is good for 60 days, okay? What about intrastate? If cattle are changing ownership, being leased, which is a major biosecurity break in my opinion, but people do that. We have clients that do that all the time, right? That are sold, exchanged, any kind of transfer of ownership, there must be a negative trich test. Again, 3 negative cultures, 1 week apart, or 1 PCR will be accepted. And these virgins, or they're less than 18 months of age, there must be a signed statement certifying this, that they've been no exposure to cycling females. These results, the intrastate, don't let me confuse you, the intrastate change of ownership, that is good for 90 days, okay? That's good for 90 days, the results of those tests. What about stockyard bulls? If you're doing stockyard work, I love doing that. Some people don't. I love it. So you got these bulls coming in. Those bulls must be tested. They can't be quarantined until they're negative. If they're being purchased out of the slaughter pen, and a certified veterinarian must do the testing on those bulls. So important that you recognize that, and also the veterinarian being certified in the state of Mississippi. You're doing work in multiple states. Here's just a summary. What I'm going to say, the cultures, again, 3 separate tests, 1 week apart, the PCR, a single test, and this must be submitted to a laboratory that's accredited, or you have to talk to the state veterinarian and ask them if they can, what lab that they will accept this at. Pooling is accepted at the laboratory for this type of testing, but it all must be done in the laboratory in up to 5 samples, which is common amongst most accredited laboratories that they will accept that. Here's a sample submission. I put some information down here on these slides where you can get in touch with the diagnostic lab. Here's 2 phone numbers and also their website. I put the trick form that's on the website available to you. Just download that form. It should be sent in triple containment, not directly on ice. And when you think about that in the summertime, we have done some work with that UPS truck with Dr. Hairdrover, and it is hot. Okay, so when I say not directly on ice, I mean you can put some ice packs in there, but just buffer it with something between there. Is what we do so that we don't cook those trichomoniads in the back of a UPS truck. That work that Davidson and Androck did was phenomenal, eye-opening to see how hot it would get in the back of a UPS truck in the summertime. If you're going to incubate them at the clinic, it's recommended to incubate them between 96 and 100. Do not ship it or to arrive on the weekend. I do recommend shipping overnight. Everything out there in the literature, no matter what the molecular test, the culture, the results are better if we get it to the lab faster. We take care of these samples. But here is, it should get there within 5 days if you're going to incubate it, and it's important that you let the lab personnel know that you incubated it. Okay. I am out of time, and I'm between you and lunch, but I'm going to tell you, thank you so much for listening to me talk.